The nation's largest pediatricians group is making its strongest push yet to have all children screened for autism twice by the age of 2. The main idea here, diagnosing autism as early as possible. 13 WHAM's Jen Markham spoke with a local autism expert today about the new recommendations and why early diagnosis is so important.
Right, well, Doug, the new reports actually say that children with suspected autism should begin treatment even before a formal diagnosis. Because autism can be difficult to diagnose, the AAP has listed new guidelines for what subtle behavioral signs pediatricians should be on the lookout for. Among them, if a child doesn't respond when the parent says his or her name, if the child doesn't follow when parents point out an interesting object or event, a lack of back and forth babbling, late smiling, and failure to make eye contact with people. Authors warn that kids who display a few of these symptoms aren't necessarily autistic, and that parents shouldn't overreact to what's just quirky behavior. Now, to help guide parents as to what is and what isn't autism, the nonprofit group autismspeaks.org also has just put out a website that has dozens of video clips of autistic children contrasted with children of the same age who have normal behavior. Experts at the University of Rochester Medical Center say the earlier a child is diagnosed with autism, the earlier it is to treat the disorder.
It's a step in the right direction, I think, both for parents who have concerns about their child's development, but also as a measure of improving early detection, which can lead to earlier intervention for children who may have an autism spectrum disorder.
Now, recommended treatment for autism should include at least 25 hours a week of both behavioral and speech therapy.
So they catch it early. Does that mean they can cure it or just be more effective in treating it?
Well, there is no cure for autism, but the majority of research on autism says that the earlier you catch it, the more you can live with it. You can't cure it, but the more it's easier for a child to live with autism. All
right, so catch it early. All right, thanks, Jen. We have some information on this posted on our website, a full link to that report from the American Academy of Pediatrics and to the organization Jen just mentioned, autismspeaks.org. To learn more, go to 13wham.com and click on the health page.
Charlotte High School in Rochester was